Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Stroke and facial droop. What to know? Facial palsy/paralysis is a common sign of a stroke. A stroke is a sudden interruption or severe reduction of blood supply to part of your brain. It can occur from a blood clot or bleeding. /r/n/r/n. A stroke deprives your brain tissue of necessary oxygen and nutrients. This can cause brain cells to die within minutes of a stroke onset. Facial drooping occurs when a stroke interferes with blood flow to areas of your brain that control facial muscles. It can also result from other conditions unrelated to a stroke. /r/n/r/nPhoto composite by Michela Buttignol for Verywell Health. Getty Images /r/n/r/n. Facial droop is a common stroke symptom. Research indicates that facial droop occurs in up to 60% of people with first-time ischemic stroke. /r/n/r/n. A stroke is when blood flow to a certain part of your brain is stopped or reduced so much that the affected area does not receive the oxygen and blood supply it needs to function. When the disruption in blood flow occurs, one of the following types of stroke can occur: /r/n/r/n. Without sufficient blood flow, brain cells start to die, and the functions the affected area of your brain manages become lost or damaged. This can have the following impact on your face: /r/n/r/n. Stroke face can look slightly different for everyone due to individual facial characteristics. Stroke face can involve the following changes: /r/n/r/n. In addition to physical changes, stroke face can also trigger the following long-term responses: /r/n/r/n. Stroke face and Bell's palsy are two common causes of single-side facial paralysis that are often confused. Both conditions are medical emergencies and can involve headaches, trouble eating, and problems speaking. /r/n/r/n. However, a stroke occurs as a result of a brain injury and can cause numbness, difficulty walking, and weakness in extremities. In contrast, Bell's palsy is caused by an infection or unknown causes and is limited to symptoms such as ear ringing, watering of the affected eye, and changes in taste. /r/n/r/n. Stroke and Bell's palsy are just two of more than 100 causes of facial paralysis. Other causes include :/r/n/r/n. Emergency stroke treatment can save someone's life or prevent long-term brain damage and other dangerous effects. You can facilitate emergency stroke treatment by learning stroke symptoms and calling 911 at the first sign of symptoms. This is the best way to get to the hospital safely as soon as possible. All types of stroke can benefit from emergency stroke treatment. /r/n/r/n. The type of emergency stroke treatment you receive depends on the type of stroke that occurs. Treatments include /r/n/r/n. Ischemic stroke treatment, /r/n/r/n. Hemorrhagic stroke, /r/n/r/n. Though a drooping face is a common symptom of stroke, it is possible to have a stroke without facial symptoms. Using the acronym Be fast to recognize the symptoms of stroke without facial symptoms: /r/n/r/n. B. Balance. Be aware of any sudden loss of balance. /r/n/r/n. Eyesight change. Watch for blurred vision, diplopia, double vision, or a sudden loss of eyesight. /r/n/r/nF. Face drooping. Look for drooping, numbness, or an inability to smile on one side of your face. /r/n/r/n. Arm weakness. Check for weakness or numbness in your arms. /r/n/r/ns. Speech difficulty. Look for an inability to speak normally, slurred speech, or the inability to repeat a simple sentence correctly. /r/n/r/nt. Time to call 911. If any symptoms are present, reach out to 911 immediately. /r/n/r/n. Rehabilitation for facial drooping after a stroke can help you regain control of facial muscle groups to restore function and expression. Though spontaneous recovery of facial drooping after stroke has been reported in up to 67% of cases at 6 months post-stroke, about 33% of those affected have persistent facial drooping after 6 months post-stroke. /r/n/r/n When facial drooping remains after a stroke, rehabilitation that uses active therapy, passive therapy, or a combination of both may help. /r/n/r/n Active therapy, called facial neuromuscular retraining, is performed under the guidance of a physical therapist. It involves highly specialized treatment to help you relearn basic facial expressions and movements. This non-surgical treatment can support optimal recovery from facial paralysis or facial nerve damage. Active therapy can include /r/n/r/n Passive therapy, which involves treatments performed without your active participation, can include /r/n/r/n Rehabilitation results and recovery time depend on many factors unique to your situation. The severity of the brain damage, age, and the management of other physical health conditions can impact your progress. /r/n/r/n When physical rehabilitation is ineffective, you may benefit from one of the following surgical treatments to treat facial drooping. /r/n/r/n Follow-up care when you return home after a stroke can be different for each person depending on the physical and mental impact of the stroke. Rehabilitation takes advantage of neuroplasticity, your brain's ability to rewire some of the circuits lost after a stroke. Depending on your condition, rehabilitation can take months to years to achieve improvement. /r/n/r/n Follow-up care at home after a stroke can involve /r/n/r/n People who have had a stroke have a high risk of having another stroke. Know the signs of a stroke to alert others about your condition. Look for symptoms associated with BeFast. Call 911 immediately if you or a companion has any of the following symptoms. /r/n/r/n Facial droop is viewed as a medical emergency because it is a common symptom of a stroke. It most often affects only one side of your face. In addition to paralysis, it can involve slurred speech, drooling, or problems with normal eyelid opening and closing. /r/n/r/n Facial droop from stroke often resolves on its own without treatment. When this does not occur, physical rehabilitation or medical treatments may improve appearance and restore function. /r/n/r/n Facial paralysis, even for a short time, should not be ignored. Call 911 if you or anyone near you has sudden facial paralysis. Learn to recognize signs of a stroke with the BeFast system. This can help ensure that you and others receive prompt stroke treatment, which can support the best outcomes. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.